This is Dr. Stephen Rath with Fusion Medical Spa and Wellness in Ruidoso, New Mexico, and this is another installment of our continuing series regarding patient frequently asked questions and more specifically how we do things differently at Fusion. Most people have heard of Allergan medical products as the #1 aesthetic line in both the United States and the world. I am proud to be a physician consultant for Allergan and a physician trainer, and one of the questions that is often asked is, what does it mean to be a consulting physician or a physician trainer for a medical company? As a consulting physician and physician trainer, when there is a new product line or a potential product line, consulting physicians are asked initially what they think their patients are interested in, and then when there's a new potential product or a product that's awaiting FDA approval, that group of physicians is often given the opportunity to use it on their patients and provide feedback. Allergan's newest introduction to the facial portfolio is Velour. Velour is a filler that's designed for the lower face, specifically for the nasolabial folds and marionette lines around the mouth. And it's really unique in that they have been able to change the structural properties, so now we have a filler designed for use in the lower face that lasts up to 18 months. Previously, facial fillers, for instance, Juvederm Ultra Plus and Juvederm Ultra, would last up to a year or sometimes a little bit longer than a year. Due to the new the change, it's called Vicross technology, Velour will last up to 18 months. So in conjunction with Voluma, the filler that's designed for the cheeks that will last up to 2 years, now we have a filler that's designed for the lower face that will give a good 1.5 year difference. One of the key points when we're talking about treating patients with facial revolumization is that we want the face to get back to its more youthful appearance. The inverted triangle with the base of the triangle on the top tapering down to a point at the chin is what's referred to as a youthful appearance. As we age and as we lose volume, specifically in the temporal area, in the cheek area, and the collagen and elastin structures start to succumb to the results of gravity, what happens is the volume that was here tends to fall down and gather around the cheeks and the jowls, and instead of an inverted triangle, you get more of a square shaped look. The pivot point actually is, in most patients, is usually somewhere right around the bridge of the nose, and if you people watch, you can actually start to see that the crow's feet and the nasolabial folds and the marionette lines and the jowls themselves are caused by the cheeks pivoting down. And so when we do facial filler, the first priority is to start up high and then work your way down, and that's what's going to duplicate a younger, more youthful looking appearance without causing a fake look. While people in some parts of the country are comfortable with the fake look, I certainly am not comfortable making my patients look fake, and the patients that gravitate towards this practice are interested in looking very natural as well. So I think that does a good job not only talking about Allergan's new facial filler, but the way that that we inject here and the way that Allergan worldwide physicians are trained, how I train other physicians to inject facial fillers.
Dr. Rath, as a board-certified anesthesiologist, can you tell us just a little bit about how your extensive training and comfort with needlework specifically sets you apart in this area of facial injectables?
Okay, so that's an excellent question, and it's not unusual for new patients to come into the office and say, you know, you're an anesthesiologist. What in the world is an anesthesiologist doing facial stuff, doing aesthetic medicine? If you put an anesthesiologist and a dermatologist and a plastic surgeon all up side by side, which physician do you think gets more training in needlework? Hands down, it's an anesthesiologist. When I went through my anesthesiology residency, I had no idea that we would be creating this anti-aging wellness practice, aesthetic medicine practice that we have today. But looking back, if I was given the opportunity to do a dermatology residency or plastic surgery residency, I would still choose anesthesiology. An anesthesiologist is trained to think about structures in 3D. So when we think about aesthetic medicine, that's exactly what we need to be looking at. Not a flat two-dimensional object, but we need to be thinking about the face or the body in three-dimensional pictures, structure, and that's what allows us to get really good results when we're doing injecting, whether it's Botox to relax the muscles, whether it's using something like Kybella to remove volume or submental fullness, or whether it's using the Allergan portfolio of facial fillers, Voluma, Velour, and Volbella to restore youthful volume that was lost. So that's an excellent question, and as an anesthesiologist, I am trained to be able to think three-dimensionally, be able to visualize the end of the needle, and that's why it carries over into other procedures like laser liposuction or sclerotherapy or any number of other procedures that are used to improve aesthetic looks and improve physique.
Dr. Rath, does Fusion Medical Spa guarantee desired results with the injectables that you offer, and how do you accomplish this level of patient satisfaction?
A good question. There's not a physician out there that I'm aware of that will guarantee results or 100% patient satisfaction. We get as close to it as I think is reasonably possible. For instance, when we do Botox on patients, we bring them back for a 3-week follow-up, and if we've treated an area, target area that the patient wanted us to treat, and they are not happy with the result, meaning they think there's still a little bit of movement, maybe the angry 11s aren't totally gone, I touch them up at my cost. So and we don't make them come back for a 3-week follow-up, but I feel much more comfortable knowing that gives me the ability to individualize the treatment to each patient, where when they come back at 3 weeks, I can see the results of what we've already injected, and then if we need to use a little bit extra to touch them up, they don't feel like, well, they've got to spend an extra $50 or $100 to get the results that they were looking for. I cover that price for them, knowing that when they come back the next time, we'll have their exact recipe already formulated. So that goes a long way towards guaranteeing results. As far as guaranteeing results with facial filler, if someone comes in and says, well, you know, I'd like, let's say it's a 25-year-old and they'd like to treat their nasolabial folds, a single syringe of velour would typically suffice. On the other hand, if someone is 55 years old and they come in and they say, well, you know, I'd like to have some filler done in my nasolabial folds and maybe a little bit in the marionette lines. My first thought is going to be, well, if we treat these areas, I can make these areas look better, but if we address the loss of volume higher up in the face, we can get by using less filler in the lower face and have the patient even happier with a more natural looking, more youthful appearance. Sometimes we get to the point where we're, you know, juggling the cost of a single syringe of filler versus a second syringe of filler, and if there's a special going on at the time, we'll certainly try to help them out. Sometimes I say, well, let's talk about maybe doing some Botox now, or maybe we could do a little bit of Volbella around the lips and give you some time where when you come back next time, we'll be able to do, you know, 2 syringes of Voluma, 1 in each cheek, and then we can talk about moving further on down the timeline. You know, maybe doing some come back and using some velour in the nasolabial folds and marionette lines. So a large part of patient satisfaction is actually about setting the expectations appropriately. If a patient comes in and they need to lose 100 pounds and they want to use some Kybella on their cheek or on their submental fullness, the under the chin fat, I'm going to talk with them not only about the benefits of using some Kybella there, but also about the benefits of weight loss. So if we set patients' expectations appropriately, if I don't promise the world and underdeliver, if I promise appropriately and then deliver what I promised or overdeliver, then that's where we have the really good results that our patients are happy with. So there's not a physician out there that's going to give a 100% guarantee of patient satisfaction, but if you set expectations appropriate and you do stuff like bring patients back for a no charge 3-week follow-up, I think that does a really good job with helping meeting what patients are actually looking for.
And finally, Dr. Rath, what anesthesia options do you have available at Fusion to manage a little bit of discomfort during the injections?
Okay, so when I grew up in New Braunfels, Texas, and went to school in San Antonio, and part of the daily commute was past a billboard that advertised sedation dentistry, and they said we cater to cowards. So I'm not sure about the terminology there, but I certainly understand the desire to make patients comfortable. If I'm doing an injection on someone and they're obviously uncomfortable, high level of anxiety, or it seems like every injection is way more uncomfortable than it normally would be. Typically, that's there's an anxiety issue, and we've done things from the gamut of, okay, well, we'll give you a ball to squeeze on, and we'll help talk you through it. And sometimes that's all some patients need. Sometimes giving them the option of using some nitrous oxide laughing gas. That makes a big difference, and we actually have some options where we can give them a special headgear that goes across the nose, where we can still work on the around the mouth area at the same time, or we'll give them the option of having kind of a looks like a breathing tube that they can hold between their lips and breathe in and out, and then when they're ready, when the anxiety level has gone down, then we can do the injections. For some patients, if there's a really high level of anxiety, sometimes they say, well, can I have a glass of wine before I come in? Absolutely. I don't want you to drink a whole bottle of wine before you come in. You need to be able to have a reasonable discussion about expectations and what you're looking for. But having having a glass of wine before you come in is appropriate. High levels of alcohol can prolong bleeding times, and so we don't want patients to come in fully loaded or having gotten really inebriated the night previously. But sometimes having a little bit of wine on board, sometimes we'll write a prescription for anti-anxiety medications just for the procedure. And we've actually had some patients with really high anxiety levels, and oftentimes in these patients there's been post-traumatic stress disorder or some life experiences that have really keyed them up. And for those patients, we'll offer not only to at a later time treat their post-traumatic stress disorder with ketamine infusion therapy, but for the aesthetic procedures, we'll offer to knock them out with some propofol. It's considered conscious sedation or monitored anesthesia care, and we essentially use standard operating room monitors, IV sedation, put them to sleep, and when they wake up, the procedure is done. You lose the ability to interact with the patient while you do that, so if the anxiety level is that high, generally there's a much more in-depth conversation in front of our 3D imaging system on exactly what they're looking for. But we've essentially run the gamut between treating patients with a little bit of hand holding, and I forgot to mention we do offer numbing cream, and we use cold spray on a regular basis. That doesn't really set us apart from other practices, but essentially offer a wide range of nothing to we can, as an anesthesiologist, I can put you all the way off to sleep if that's what it takes to make you comfortable for the procedure. So thank you so much for taking the time to watch a little video on what we do at Fusion and how the practice at Fusion Medical Spa sets us apart from other practices. Thank you.